that cancer, once we get cancer, we know that we have cancer. But before that, we should all be aware of what cancer is and how we can check on whether we are getting cancer or not. So which is basically called screening for cancers. I am Dr. Shamita Ghosal, consultant gynecologist and obstetrician at the Nightingale Hospital. Nightingale Hospital is a place which I say is a one shelter where you can get all kinds of treatments and good care and investigations. So coming to screening for cancers in women, what I would like to specify on is the breast cancers and the cervical cancers. Now for breast cancers, it is advisable that all the women above the age of 40 should go ahead with the annual mammography screening program. I want to emphasize on the word screening. Screening means we are trying to pick up cancer before it comes up with symptoms, so that we have options of treating you and giving you a better survival rate. So screening for breast cancers is kind of must, and we should be going ahead with the mammography things. If we have a lump or something, then probably a high level, high resolution ultrasound is what we would have asked you to go ahead with. Now coming to the next point, which is the cervical cancers. Now cervical cancers is much less talked in our country than the huge volume of problem which we are actually seeing. The reason being that people are not aware of what should be done about it. We should get an pap smear done. Pap smear is a very simple test, but somehow in the society it is being given a feeling that it is a very painful test. It isn't that painful. We pick up some smears from the cervix and we look under the microscope and we just check out what is the possibility of developing cervical cancers. So we should get a pap smear done once in every 3 years if you are less than the age of 50, and your screening should start after you are the age of 25. So cervical cancer screening is again a very important thing which is not happening very regularly among our women. So in the Western world, actually once you turn 25, you get an information that you are due for your screen. So even if you don't visit a gynecologist, you go and get your pap smear done. That should be the level of awareness. The third thing which has come up is the cervical cancer vaccines. So cervical cancer vaccines are there available, but then there is a misnomer. People feel that it is a cancer vaccine. Yes, it is a cancer vaccine, but it is only covering the cervical cancers. So even if you get a vaccine for cervical cancers, in that case also you should keep yourself screening for the pap smears and also get an ultrasound done to check for endometrial or an ovarian cancer. So that goes for the cervical cancer vaccines. But again, even if you are not able to visit your gynecologist on a regular basis, these vaccines are available in the market. It has to be taken as 3 shots. So you should consider getting vaccinated if you haven't got vaccinated. And even if you're vaccinated, you should go ahead with the pap smear screening.